So, hello everyone. I'm Norio Sakai, Director of Twin Research Center Osaka. Today, it's very happy that we had the Japan-Hungary joint twin seminar together. And from now, I would like to start the question and answer part with Hiroto Takahashi and Adam and David from Hungary. We meet at Zoom. So first of all, I would like to appreciate the Hungary team to join our idea to make this very nice seminar. I think I have already checked both of your slides and I enjoyed it. So from now we would like to do a free discussion each other. So maybe, Adam and David, could you start the question to the Hiroto start?
Yes, of course. Thank you very much for the kind introduction. So I'd like to ask the questions to Hiroto. And, one moment until we find them. Okay, so your first question is DTI-based brain fiber network in white matter microstructure influenced by epigenetic control and influenced by the gut microbiome? And do you plan to study that phenomenon in twins?
Thank you for your good question. When it comes to this question, now I have an idea of research to examine what extent each genetic or environmental factor affect on the specific region of brain, such as the hippocampus or important fiber, cortical spinal tract, regulating a motor, motor function. But unfortunately, I'm not familiar with the genetic information related to research, so I have no idea about epigenetic so far. Meanwhile, I'm curious about the relationship between the brain and the gut microbiome. So yeah, I guess to do this, I have to deal with numerous big amount of characteristic of both brain and gut microbiome derived data. I think it's a big data. So I presented in my presentation document radio mix technique may be useful for this research. I think it's a good idea for doing future research. Thank you.
Thank you.
Yeah, it must be a very interesting topic to consider about the effect of the microbiome or epigenetic control to the central nervous system. Last time I see some news for the mouse model. Today, someone put so many oral bacteria to some mouse and check after the 3 weeks later, check the brain, pathogenic, see some pathology similar to Alzheimer.
All right, I see. Probably
so there might be many possibilities.
Okay. That sounds interesting. Okay.
So if we can ask the second question, that how do you plan to integrate the radiomics to your DTI twin research?
Yeah, I introduced with the last part in my presentation about radiogenomics, and I think it's also a good. It's gonna be a good research as a future study. I'm planning that actually. So, but I'm not. I know it's not easy to proceed this study because of no experience of radiogenomics to me. So first of all, I also have to start learning about radiogenomics. So I'm curious about which of genetic or environmental factor affects the brain microstructure. So there's a numerous functions in brain. So I'm curious about among these ones. I'm curious about the cognitive function regulated by memory in the hippocampus. So yeah, I'm not sure whether I can make that happen. But for example, from DTI brain data, we get a neuronal fiber characteristic of limbic system, including the hippocampus, by using tractography or DTI-based parametric map, such as MD, being diffusivity or fractional anisotropy. And as I mentioned in my presentation, I think the way how to get image characteristic is important. And other data, we are supposed to deal with a significant amount of image characteristic. So the quality is, of course, important. So to do that, AI, artificial intelligence, may support this study or this idea. So, and next, we have to choose a genetic factors candidate that may relate to the cognitive function, and correlate. We have to correlate both image and genetic characteristics. So, yeah, I have to start learning genetics as well. But I'm a radiologist. I have no idea. I'm not familiar with the genetic field. So yeah, to proceed this research, radiogenomics technique is going to be required. I think welcome. Thank you.
Yeah, Hiroto is, in a sense, a newcomer to a center, but he will, in the near future, involve many ideas, including radiogenomics. Yeah, this world is very new for me. He talks about this, so I expect he will do.
Yeah, and that's a special problem that there are so many. Yeah, that's a special problem that there are so many data, a huge amount of data which can be extracted from the radiological EVG. So that's really also a hard task to select which parameter is has an importance for further analysis or not. So it's yeah, it's not an easy task. Doesn't seem to be an easy task.
So do you have any idea regarding radiogenomics now, or are you planning?
Good question. We started to do that, but first not on twins, but on another subjects. We have performed some preliminary studies on cancer patients, for example, lung cancer patients, and the CT and MRI images of cancer patients, and right now working on other tumors, colon tumors patients as well, and then we compare of the pre-therapeutic images with the available genetic data to compare to if we found some correlation and some prediction that before the histology, probably we could estimate what kind of tumor, what might be the histological type. So that's what we are working on, but we have not adapted on twins, but we need a larger sample size. So as soon as we finally can involve the twins to the population-based twin registry, then we expect larger numbers of twins, and then we will be able to search for this kind and adapt these techniques if we have larger sample size.
Okay. And anyway, is that for lung cancer or other
yeah,
lung cancer
lung
or breast
cancer,
cancer? Or
lung cancer
lung
and
cancer.
colorectal cancer, and the one another study is the parotid cancer, so parotid tumors.
Operative cancer. Okay.
Salivary
Yeah,
glands,
that's right. How about brain tumor? Glioma?
Yeah, not here. Here we have not. That's another institute, so we have very few cases. Just at the university and here at the National Institute of Oncology, we don't have primary brain tumor patients. So actually, that's incidentally found. So that's
found. Okay.
There is a large hospital in Budapest which takes care of any of brain surgery, and there is a National Institute for neurosurgery, and most of the oncology neuro patients are there.
Okay, I see. Thank you.
Welcome.
Okay. So yeah, right.
So,
Go ahead. Yes,
next question.
Do you plan to study other MRI sequences in elderly twins, such as SPI for the microbleedings or flare, or other hyperintensity?
Yeah, that's a good question. Actually, I'm already planning about this idea and take into a practice because this finding is very common, especially in elderly people. So I think this significance, it's a very important point. So in elderly people, as you point out, white matter high signal intensity is recognized as a very common findings. So I think it's a good idea to evaluate which of the genetic or environmental factor contribute more to this finding. So yeah, but once I looked it up about this online PubMed, there are already many similar reports. And they reported that genetic factor was strong. Yeah, I think but if we plan to do such a research, in my opinion, the way how to analyze white matter high signal region on FLAIR is important. I think it's not a visual qualitative assessment, but also a quantitative analysis, like texture analysis, may be useful to do this research. Because texture analysis can make a lot of parameters to evaluate, and I also think collaboration with DTI that can quantify white matter region may come out interesting result. And when it comes to anyway, SWI susceptibility weighted imaging, assessment of microbleed distribution in twin brain may be interesting to evaluate which of genetic or environmental factor contribute. I'm guessing environmental factor, acquired factor, may have a strong effect to microbleed in brain. I think it's a hemorrhagic change, maybe mainly due to hypertension. So yeah, but I think it's worth trying such a SWI analysis. So actually, I'm planning, and I'm gonna take it into practice. I'm sure to do that.
Yeah, we completely agree. So the microbleeds are relatively rare, but so we need a huge sample size, especially in twins to achieve enough sample size. But I think that since the hypertension has a mainly genetic background, so probably it might be more similar in identical twins. But that's only my guess.
Thank you. Yeah.
That might influence the strength of the small artery arterioles wall of the cerebral arteries. Probably that might be more similar in twins. So it will be interesting to study that, especially if the twins have very similar or very different lifestyles. So
yeah, because we have a twin cohort of normal people. So I'm guessing some of them have a risk factor of microbreed, such as hypertension or the cerebral vascular diseases. So yeah, first of all, I'm gonna check the patient history as well. Yeah, good.
Okay, thank you very much for the question from Adam and David. So how about Hiroto, shall we start your question?
Okay, it's my turn. So I'll start off with first of question one. Okay, regarding genetic effect on each carotid plaques and femoral plaques, I understand that genetic factor has strong effect for both. So, and are there any research or trial to explore the specific genetics that strongly affect plaques on both arterial regions?
Thank you very much for the very good question. So yeah, that's what we have observed on both, let's say, independent arterial segments, since we must take into account that the carotid artery is an elastic one, while the femoral artery is a muscular arteries, muscular type artery. So it means that so we expected a little bit different genetic versus environmental background. However, it seemed to be that the genetic background is very similar and similarly relatively high in both conditions. So there are some research articles on the topic to study specific genetic factors, especially some lipid, mutations and factors in the lipid metabolism and of the calcium metabolism. However, I think that of course some other factors influence that as well. So depending on the type of the plaque, it seemed to be that it has really it has a huge relevance, since the calcified plaques seem to be more heritable, and this might be influenced that most of the smokers develop calcified type of plaques, and we must take into account that the smoking has a relatively high heritability, so that might probably also be in the background of this phenomenon. However, there are also of course patients who have never smoked but develop also calcified type plaques. So it seems that it's still an uncovered story, and uncovered phenomenon. And however, the lipid type or the soft type plaques, so which contain more cholesterol, seem to be less influenced by genetics. We have experienced that in many patients that also in identical twins, that they were discordant for soft plaques. So it seems to be that it's a different mechanism. And the mixed type of plaques are also interesting to study. So these are usually some progressive types of plaques which were started to develop as a soft plaque, and calcifications occurred in this plaque in later stage, later as a complication because of the necrosis inside the plaque. So there and the necrosis will develop as calcification inside the plaque. So that's why we observe these plaques as a mixed plaque type. So this is also a very interesting one. So it seems that different mechanisms might underlie between the different plaque types, and the new radiomics studies are, I think, that relatively few in this field. So because the characterization of these plaques with ultrasound so is the best or better as with the CT. And so the new programs and new techniques can help us to adequately analyze this type of the plaques. So I think that in the future we expect more radiomic studies and fields, and so that's why a thorough characterization of this type of plaques are necessary.
And interestingly, we had separated twin pair, two ladies, monozygotic twins, who reared apart for 30 years, so they were separated from birth. And interestingly, independently from each other, both were smokers and heavy smokers. And we made the ultrasound examination and also the coronary CT angio of this twin pair. And interestingly, the result, so the atherosclerosis, the location of the type of the plaques were very similar, even they were separated for more than 30 years.
Yeah, so they both had very advanced atherosclerosis.
So that's also the genetics plays a very important role, and it's very interesting.
So you mean the research for searching specific genetics is has been done?
Yes.
Okay, thank you. Thank you so much. So okay, which leads me to my next question. In the case of coronary plaques calcified plaque is more, so you mentioned that is more affected by genetic factors than the environment and factors. By contrast, soft plaque is more affected by environment factors than by genetic factors. So I'm wondering why there's a difference of effect between calcified and soft plaque. Is that difference due to a difference of that of mechanism?
I think so. Yeah, I think so. Yeah, I think that it's the mechanism might be, or the different mechanism might be similar to that of the carotid and the femoral plaques, because it's because the calcified plaques are mainly observed in smokers. So also it's very important to know the risk factors of the patient, and if there is an hyperlipidemia or is it treated or not. So that's also the treatment might also cause calcification of the soft plaques. So that's why we need to thoroughly know that if it's how the patient was treated and what kind of risk factors underlie of this phenomenon. However, if we see a soft plaques, the soft plaques in the coronary arteries are the most dangerous one because they can develop necrosis inside, and so that's why it has a different importance. It's much more dangerous as the calcified plaques, of course. So because the calcified plaques might cause stenosis, but it's not. Sometimes it doesn't change so much with the years. However, the smaller soft plaque can also develop a necrosis and the thrombus formation on the top. So I think that the different mechanisms are underlie the plaques, and I think that they might also be also at two different types of plaques can be also present in one patient. So I think yes, so for this time, until this time, it was very difficult to investigate the mechanism because it can be only observed with CT angio, and of course this is has a high radiation dose. However, in our study, the radiation dose was kept as a very minimum, so like a mammographic image. Otherwise, the ethical committee wouldn't have approved that. A very strict ethical committee. So that's why this is the first study which investigates the coronary arteries in twins. So we hope that and the preliminary results seem to be very interesting to show that that's different genetic versus environmental mechanism behind the formation of these two different type of plaques.
Okay, thank you so much. Anyway, coronary CTA exam is performed. Is a coronary CTA exam performed as a screening in your country?
Yes, we have one. We have once. Yes, that's but it's usually a non-contrast CT scan. So just for the assessment of the Egetson score. So only for the calcified plaques. But yes, we know that if there are calcified plaques, so we don't see on the unenhanced scan that if there are soft plaques, which are more important. For the thrombus and myocardial infarction formation. So that's why it has a limited information. It's only information on the calcification, which is more or less predicts the severity of the coronary atherosclerosis. However, contrast medium is needed to see the soft plaques. So otherwise, we don't know about them, and we don't know if there are high-risk soft plaques in the coronaries. So as screening, there are some. So there is no official screening in Hungary. Only there are some. There was one study that one in Budaörs, which is a relatively large town near to Budapest, who started a screening trial, then invited some patients with selected based on selection criteria, so smokers, COPD, and so on, that who could come to a CT scan, and they performed the study. There are no results yet, but there was just some research trial that they screened one town and to see that how is the severity of the coronary atherosclerosis in this small town, but this is not nationwide yet, and this was only without IV contrast.
Okay, thank you so much.
Okay.
Let's move on to the last question. The Willis circle of the cerebral artery has a variety of variants that described in your presentation. So I would have thought genetic factor mainly contribute to the formation of Willis circle. So what kind of environmental factor, so to speak, acquired factor, do you think contribute to the formation of the Willis circle? Do you have any idea?
So I would highlight to this question to the role of the first 90 days of after birth, because so the environmental factors has a very large effect on the formation of also the anatomy, and also during the time of the pregnancy, for example, the maternal smoking or eating habits have also very important role in the formation also of the Willis circle.
Yes, we were also surprised to see that difference, that even or circle of Willis is not the same. I have one hypoplastic anterior cerebral artery on one side, on A1 segment. However, David has not. So but our lifestyle is very similar. So that contradicts that. So we were also very interesting to see. We didn't expect that result. We also expected that the genetics will be very high, but it's not the case. So, and it's not a factor. And this is really a very objective measurement, so that we can't say that there was a measurement error, which might play stand behind this result. However, yes, so of course, sporadic factors might be there. So during the development, what we don't know why it happens, or some epigenetic factor, or we were thinking on probably based on the birth or the monochorionic or dicus, or probably the placenta or some vascular reasons in the background might stand. Of course, we don't know. These are only speculations because we don't know. Unfortunately, we don't have such data from the twins because at the time when the twins were born, it was not registered. But it will be interesting to see to see some younger twins who have some whose such birth data are from the gynecologist is available to see probably that if some such factors might be in the background. So I would say sporadic factors and probably some vascular factors based on the placenta or the different placental position of the twins, in utero. And I think the Professor Sakai has probably much more ideas, professional in this topic.
Okay, thank you very much for a nice discussion. Maybe I might ask a final small question. At the beginning of Adam and David's slides, you introduced the twin births in Hungary. The ratio is increasing recently.
Yeah. I have the same question.
So could you tell me what is the expected reason? Do you know?
Yeah. So that's the monozygotic twins parents is very slightly increasing. So so we don't know the effect, but it's really a very mild change. But of course, the dizygotic twins pregnancy is the main thing whose number is increasing. So there are some factors in the background of this phenomenon. One is since in the 80s, the in vitro fertilization was introduced, and some contraceptive have been introduced, and there were some pills which increased the number of the twin, or increased the twinning rate. The other thing that in 1990 the communism has finished, and there was the lifestyle has a huge change in most people, and of course the ladies started to be pregnant in later stages. So in the 30s, 35, because they started the universities, it was not so easy during the communism, and they started the universities, and the date of the birth, that's why the pregnancies became even later and later, when the twinning rate has the peak at 37, 38 years. That's the peak of
so nowadays the career is usually the number one, and the second is the pregnancy. So that's why everything just moves the more later when the peak of the twinning rate is higher. And
so it is expected to be found in many countries. Okay, thank you very much.
Yeah, and also nowadays the government forces the people to be pregnant for the ladies. So there are many government support
to stop the decrease of the population size. So it seems to be successful, because of course there is no immediate effect, but it seems to be that there were some years which passed by since the first regulation, but it seems to be that it started to increase again. So hopefully then it's the decreasing trend of the population size will change. And there will be more twin rates, because that's why as well.
So maybe I would like to check my memory. So finally speaking is David?
Yes.
David.
He's Adam and I am David.
Okay. Okay, thank you very much. And I would like to close. And that in future, we really expect to continue the collaboration, Japanese group and Hungary group in future. So I would like to ask Adam and David to do a closing remark. Could you?
Yeah. first of all, we are very proud of this collaboration. I think it's more than just a professional collaboration. It's like a friendship between the two teams. So we are very grateful of your team, and it was fantastic to get to know your colleagues who visited Hungary, and we are very grateful that also our students and the team members could visit your fantastic center. So I think it's just the start of the collaboration, and we hope that the funds and the future will be also helping us to develop even more and more stronger collaboration. So that's why it's I think we thank you very much for organizing this joint research seminar, which helps us to understand that how we progressed in the collaboration and to see the future directions as well. So thank you very much for the possibility.
Thank you so much. Thank you so much.